I've been racking my brain as to how this bug got there. Gotta agree with Tom. You're the only person could have planted it. That day you gave me the AKG. I could tell you were nervous.
Ray, I swear I have never seen that thing before.
I can't tell you how disappointed I am.
I don't know what to tell you. Just know that while I was treating you, I was the best doctor I could be.
That sounds like a confession to me.
I wanted to give you the MRI results. You wouldn't answer my call.
Stop changing the subject.
Listen to me, Ray. You're slurring your words. Your balance is off.
Enough.
We need to get you in immediately. See a neurosurgeon?
Stop! You're not getting yourself out of this.
Hey, Pop.
No, Tommy, I'm busy. What do you mean he's in the hospital? You said Corcoran wasn't gonna be a problem.
I just found out myself. I thought I'd been taken care of.
We're not done here. I want answers.
Go get Bill. I know. Get him now! All right, I got this!
Come here.
Go on
Now.
He just collapsed. What the hell are we supposed to do?
Check him out, Will.
Ray, can you open your eyes? Need a flashlight. Your phone.
Oh, God.
His left pupil sluggish. Ray, did you hit your head? He's unconscious. It's getting worse.
What does that mean?
He's not responding anymore. There's a bleed in his head, putting pressure on his brain. We have to get him to the hospital now. Call an ambulance.
Can't you fix him here?
You're kidding me. No. The pressure in his skull needs to be released.
Maybe we should take him to the hospital, Tommy.
Don't be an idiot. Okay, hospitals mean police.
But Pop is lying here.
No. I'm making this decision. Figure something out now.
I'm gonna need a few things.
Then do it.
Do the same with the bit.
Be okay, Pop. Just stay calm.
Pass me the drill.
How do you know where to put the hole?
His MRI. The hematoma was just about here.
It's just about. What are you guessing?
You want certainties? Let me bring him in.
Will. You better guess right.
Stop pointing that at me. It's best if my hands aren't shaking. Tim, I need you to hold his head as still as you can. There you go. If I go too deep, he's dead.
God. What did you do to him? What did you do to him, Will?
You all right, Pop? You're gonna be all right.
You sure we can't keep him here?
He has a hole in his head. He's at risk of infection. He needs an ICU and antibiotics. Easy.
Where do you think you're going?
to the hospital. I gotta tell the doctors what we're looking at.
No.
Tommy, I swear I'm not gonna say a word about this to anyone.
Stay here. Clean this up.
Wait! Tell the doctors he has a history of subdural hematomas. If they need to, they can call med for the MRI and keep him sitting up.
The purpose of the Glenn procedure is to improve Sophie's oxygenation and reduce pulmonary artery pressure.
Any questions?
No. The operation is not without risk, particularly in light of Sophie's previous surgery. Each time you open the chest, it becomes more difficult. We expect Sophie's adhesions to be extensive.
But we are optimistic. She's a strong little girl.
Okay, thank you. Doing great.
They're great surgeons, Philip. Sophia's in the very best hands.
You know, it might just be because you're here, but I just think that everything's gonna work out.
Dr. Rhodes.
She's bleeding. Suction?
Suction.
It's coming from her right atrium. The adhesions in the sternum must have torn it open.
Damn it. Let's do a sucker bypass.
Sats are down to 52.
11 bladed and aortic cannula. I'm in.
Sats are up to 76, 80.
Prolene stitch for the SVC cannula.
On the left as well.
We need a new plan. There's no way to anastomose to the trunk of the artery. We need to attach further up the right side.
But if we don't attach to both sides, she'll only oxygenate half her blood.
It's a lot better than none.
She'll never set above 75 for the rest of her life. She'll be in heart failure by the age of 30.
Which can be controlled by medication.
Oh, no.
I won't let this girl die because we tried to bite off more than we can chew.
I know this is a difficult time for you. You've suffered a loss. But I've seen you do things in the OR that I did not think possible. This is not the time to back away from a challenge.
All right. 2 anastomosis sets. Let's move it. Time on pump.
3 hours, 14.
Should we take her off bypass?
How's she doing?
Pressure's good. Normal rate and rhythm.
Sets are at 88. She's going to make it.
Close if you don't mind.
Not at all.
Patient name, Glenn Simon, 57-year-old male, GCS 15, vital stable. Got knocked off his horse at the polo ground, gross deformity to the right femur.
All right, let's go to T3.
Mr. Simon, can you tell us what happened?
My buddy Harvey is a cheater, that's what happened. Trying to pull a 90-degree ride off. Knocked me clear off my pony.
All right, let's get X-ray and call ortho.
Got it.
All right, let's move him on my count. Ready? 1, 2, 3, go! Mr. Simon, any pain?
Not there.
Okay. Oh, looks like you found it. Yep. Let's get him off the board. All right, on my count, 1, 2, 3. Gently. There we go. Get an IV started. Take a bolus of saline. 5 milligrams of morphine for the pain. We're gonna get you fixed up, Mr. Simon.
I never like to admit that my wife is right, but I'd be in a lot less pain if I stuck to golf like she has.
Mr. Simon? Mr. Simon, can you hear me? He's stroking. All right, give 20 milligrams of labetalol. Let's get him to CT and echo now.
Mr. Simon, we're taking you up to the surgical ICU. You understand?
Glenn, honey, I'm here. Glenn, Glenn,
Mrs. Simon?
why isn't my husband saying anything?
Mrs. Simon, I'm Dr. Rhodes. I'm taking care of your husband. Why don't we find somewhere where we can talk? So your husband has what is called a bifurcated vena cava. It allowed the emboli from his leg fracture to bypass his lungs and go straight into his brain. With your consent, I would like to operate.
I'd like to get a second opinion. Glenn has a partner who's on the board at the Mayo Clinic, and I'm sure he could refer us to a cardiologist there.
I understand. As long as he has the fracture, he's at risk of having another stroke. And we can't fix his leg until I fix his heart. Waiting could put him in even greater danger.
Fool still thinks he's 25 years old. I came here to give him a piece of my mind, and now this.
Mrs. Simon, we have a great team here at Gaffney. I believe when your husband comes out of surgery, he's going to be good and ready to receive a piece of your mind.
Okay.
Cooling jackets prepped?
Standing by.
Then let's do this. Scalpel. All right, go on bypass. Cool to 20, but do not crash cool. Find me when it gets to 32 degrees, and we'll arrest the heart.
Yes, Dr. Rhodes.
Where are we?
Body temperature's at 20 degrees Celsius.
Flow down. Clamp.
Clamp.
Clamp is on. Give cardioplegia.
Pleases on. Heart's arrested. Start the clock. Stage is yours, Dr. Rhodes.
Mets and DeBakey.
Here, Doctor.
Time?
6 minutes.
Precisely.
6 minutes, 11 seconds.
You still have another layer to go.
Damn it, more suction.
You have clear line of the vessel. Suction is not your problem. You're not gonna make it.
I have plenty of time.
Not at the pace you're going. You've done 57% of the work and 81% of your allotted time. You are not gonna get there.
Your nonstop number crunching isn't helping.
30 minutes. That's what we agreed. That's what you promised. I'm taking over. Step aside, Dr. Rhodes.
I can do this.
Step aside. Dr. Downey may have been quick to put his faith in you, but my faith takes longer to earn.
Ava! Hello.
Hello, Dr. Jeffrey.
How great to see you.
Your trip was all right?
Well, as all right as an 18-hour flight can possibly be.
You already know Dr. Latham. This is Dr. Rhodes, another CT fellow.
Ah, great.
Dr. Jaffrey is not only one of the world's greatest heart surgeons, but was also my mentor in Cape Town. Taught me everything I know.
I have read your book, Dr. Jaffrey. It's an honor to meet you.
Oh, please. I'm just another patient today.
There's a tumor on the upper lobe of Dr. Jaffrey's right lung.
It's invaded his superior vena cava, obstructing blood flow to his head and upper extremities.
We'll need to remove a portion of the lung and resect the tumor.
And I want my star pupil to oversee the procedure.
Thank you for your confidence, Dr. Jaffrey. Yeah. We're getting an OR prepped as we speak.
Just one thing. I don't tolerate anesthesia well.
Well, we can talk to the anesthesiologist about adjusting your cocktail.
No. I think I have a better idea. You place a higher epidural and load me up with bupivacaine.
Hold on, you would like to be awake for the surgery?
Well, strictly as an observer, of course.
No, it's just that we would be taking an unnecessary risk. The epidural site could hemorrhage from the blood thinners alone. You could be paralyzed.
Not if we do it off pump.
Right. We can construct a temporary graft from the brachiocephalic vein to the right atrium, clamp the superior vena cava, and remove the tumor.
Certainly eliminate the need for a bypass.
Exactly.
Absolutely. We'll do it. That is, of course, if it's okay with Dr. Latham.
Good. I think Dr. Jaffrey has alleviated my concerns. I'll make the arrangements.
Thank you.
I'll let Wolfspan know about the high epidural.
Did we really just agree to allow a patient to be fully awake while we perform open heart surgery?
Dr. Jaffrey is well aware of the risks and has given us his consent.
There is no way that we can guarantee we'll neutralize all of his pain, and even if we do, every time his lungs inflate, it'll obstruct our field.
I have faith in our anesthesiologists and Dr. Becker.
Awake surgery is extremely risky and should only be performed when medically necessary.
I understand your concern, Dr. Rhodes. But I trust Dr. Jaffrey's judgment and respect his desire to observe. If I were in his situation, I certainly would see my own beating heart.
Some pressure.
Yeah, I can believe that.
My ventricles, contractions still look strong. No fatty deposits. My coronary arteries pristine.
Very healthy heart, Dr. Jaffrey.
You eat a lot of oatmeal, Dr. Jaffrey?
Good one.
I'm ready for the scalpel.
What? Why a scalpel?
I need to divide the azygous vein.
But shouldn't you do the entire dissection first? Save that to last.
She's got a good angle on it now.
Yeah, but what happens if something goes wrong? I mean, good Lord, you won't have enough collateral blood flow to bypass the obstruction.
Dr. Jaffrey, I want to remind you that you're awake to observe this operation, not conduct it.
Oh, sorry. Force of habit. Please proceed, Dr. Becker. Well, surely you don't intend to use a quartering knife.
I thought it would help to...
It'll help her keep ahead of the bleeding while she cuts.
No. You do not touch me with that torture device. Did I fail to teach you proper surgical technique?
You always said it's important to maintain hemostasis.
Yes, after the cutting and the tying of the vessels individually, not charring them with a bloody cautery knife.
There's a lot of cooks in this kitchen.
Yes, well, my well-being's at stake here.
I understand, Dr. Jaffrey. I'm fine. Give me the meds. There. I've got everything. I'm ready to reconstruct the vena cava. Give me a 20mm Dacron graft and a 3/0 proline stitch.
No. 3/0 is far too heavy for a graft this size.
I thought the 3/0 was appropriate.
No. All right, that's it. You're out.
That's enough, Dr. Jaffrey.
It's my heart, and I'll tell you when it's enough. Rhodes. You're in. Take the instruments. Now.
Dr. Latham, I believe that it's time to put our esteemed patient under general anesthesia.
What? No.
I think it's in his best interest.
Look, wait a minute. We had an agreement. Come on.
Alan, if you would please.
No. Alan, you do not. You wouldn't dare.
What? Oh. How about that? So quiet you can hear a heartbeat. Now, Dr. Becker, I believe you were about to sew in the graft with a 3/0 stitch.
Suture and DeBakey's? We were able to completely remove the tumor and reconstruct the superior vena cava.
Dr. Jaffrey.
You disappoint.
Dr. Jaffrey, everything went perfectly. All according to Dr. Becker's plan. You were right to put your trust in her. She is a first-rate surgeon.
Get some rest, Dr. Jaffrey. I'll be back to check on you soon. Connor. I have to go put in my surgical notes.